Good afternoon and welcome to the St. Clair County EMA Daily Briefing here on day 281. I'm joined by EMA Director Herb Simmons today. The health department is tied up at some other meetings dealing with some vaccination planning efforts, so they won't be with us today. So we'll get right into the numbers. Tested in St. Clair County, we have tested 191,697, which is an increase of 1,290 since yesterday. Positive cases have been 19,048, which is an increase of 157 since yesterday, and those are males and females under the age of 1 and to over the age of 100. Our daily county positivity, unfortunately, today is much higher than yesterday. We're up to 12.2%. Negative tests have been 172,649. And unfortunately, we are announcing an additional death today, bringing our death total to 295. And that was a male in his 70s who did have underlying health conditions. For those that have completed their IDPH required 10-day isolation period, we are at 16,779. For state tests, they have tested 12,356,446. Positive test results have been 894,367. That's an increase since yesterday of 7,652. For deaths in Illinois, they are unfortunately announcing an additional 108 deaths, bringing the death total to 15,123 here in Illinois. For hospitalization numbers, in St. Clair County hospitals, we have 108 COVID-19 related patients, and 12 of those patients are on ventilators. Regionally, we have 211 COVID-19 related patients, with 21 of them on ventilators. For our congregate living facilities and outbreak status, we will announce those that have changes today. Caseyville Nursing and Rehab is at 157 cases and 8 deaths. That's an increase of 1 case. Freeburg Care Center is at 39 cases and 0 deaths. That is an increase of 5 cases. Mercy Rehab and Care Center in Swansea is at 73 cases and 0 deaths. That's an increase of 7 cases. St. Paul's Home in Belleville is at 127 cases and 17 deaths. That is an increase of 5 cases. And Willow Creek in Belleville is at 11 cases and no deaths, and that is an increase of 1 case. I'll now turn it over to Director Simmons for some more of the update.
Thanks, Brian. We'll move into the zip code report as we do every day. 62201 goes up 1 to 443. 62203 goes up 5 to 481. 62205 goes up 4 to 473. 62206 goes up 9 to 926. 62207 goes up 4 to 432. 62208 goes up 10 to 1,090. 62220 goes up 19 to 1,324. 62221 goes up 20 to 1,796. 62223 goes up 14 to 1,151. 62226 goes up 31 to 2,057. 62232 goes up 4 to 628. 62239 goes up 2 to 282. 62240 goes up 1 to 95. 62243 goes up 9 to 445. 62254 goes up 1 to 585. 62255 goes up 2 to 52. 62257 goes up 1 to 2,007 or 207. 62258 goes up 4 to 694. 62260 goes up 2 to 476. 62269 goes up 23 to 2,028. 62282 goes down 1 to 43. And 62285 goes up 7 to 378. As Brian said, we've seen a jump today in our daily county positivity rate. It was 6.9 yesterday. We went up to 12.2 today. The regional positivity stays at 12.0 as it was the last couple of days. The county 7-day rolling average is up to 10.5 from 10.1 yesterday. So the numbers took a little climb back today. The county around us came in today. Bond County 9.3%, Clinton County 5.9%, Madison County 15.5%, Monroe County 19.7%, Randolph County 11.3%, St. Clair County 15.3%, Washington 11.8%. Those are the surrounding counties. The other number, 66 people under the age of 40 tested positive yesterday, Brian, from the COVID.
Yeah, what's important to remember, and you talked about it, we've seen this change. We're going to have good days, we're going to have bad days. It's going to be that roller coaster. Kind of depends on how many test results the labs can process, how much gets in. But it's important for everyone to remember not to let their guard down. We were very excited to report this week that the vaccine has arrived, and they've started those vaccines, and some of our frontline healthcare workers that have been leading us through this entire pandemic and now leading us down the final stretch. But it's not time now to let the guard down. We've still got to continue with those 3 W's and making sure that we're doing everything we can, because it's going to be several months before we're going to be able to vaccinate everyone here in the area.
Well, and the other numbers that we're really watching are the hospitalizations. 108 people here in the county, and 12 of them on ventilators, and then regionally 211 with 21 of them on ventilators. Those are other numbers that we really have to watch, those hospitalizations.
That's correct. We've had the doctors on here. We've had the hospital administrators talking about that right now. The hospital numbers are higher than they've ever been, and with the hospital numbers being higher than they've ever been, and staffing with a lot of the healthcare providers becoming ill with the virus, it's been troublesome, and that's still something very important to watch. We remain below that 20% threshold in both categories of ICU and medical surge beds, and even though we get the positivity rate down, nothing changes unless those hospitals come down with it.
Exactly, and we talked this last week about how we were fortunate with the Thanksgiving Day holiday. The surge that was being predicted, we didn't quite see that, but as we've been saying all week long, with the Christmas holiday coming on, now is not the time. We have to stay vigilant to the fact that it's just normal. It's the beast in all of us that Christmas, the big holiday, everybody wants to get together, and unfortunately you have to be careful, just like you were with Thanksgiving, because as Brian said, these numbers are going to fluctuate. We're watching them every day, and the state watches them, and that's why we bring them to you. But we have to stay focused. Even though the vaccine's here, as Brian said also, it's going to be several months before it gets into the general population.
Something important to talk about there with the vaccine. The vaccine is not a cure for someone that's infected with COVID. If someone comes down with COVID now, they can't give them the vaccine and it makes it go away. It is a preventative vaccine. Yeah, exactly. So this is not the magic treatment that, hey, if I get COVID, I just go in, they give me a shot and it goes away. It does not cure someone that is already sick with COVID.
Well, I noticed on the page, Team St. Clair does so great in helping share and spread the word. There were some comments last night and today that, well, now that the vaccine is here, aren't we in phase 5? And doesn't that mean that, everything is okay? No, that's the farthest thing from the truth.
We've got it. As Dr. Ezike said yesterday, there's a difference between having a vaccine and being vaccinated.
Right.
We have to wait until we get enough of the population vaccinated that will help lower the spread of the COVID-19.
And even though we told you this week, we're heading in that right direction, 281 days. It was great that St. Clair County got the first doses in. You saw it right here. We showed the doctors and the healthcare workers that were some of the first to get the vaccine. That's progressing on. Like we said, the health department is working on that scheduling. around the clock sometimes, and amongst everything else they have to do. As we say each and every day, we're all in this together. Our businesses are continuing to do the best they can, and we have to try to help them. We're going to have hopefully a couple of those doctors that got vaccinated the other day. We'll have them on the program here this coming week to find out how they're doing, if there was any side effects that they can discuss with us, and to maybe help ease some of the questions that some of you may have out there. Dr. Bodeman is one of them that I'd really like to get to come on, and Dr. Schaefer, just to kind of get their input. So we'll work on that this week, because there's been a lot of questions, and a lot of people have been calling and leaving messages on where can they sign up to get the vaccine, so that's a good plus. But again, we're referring them to the health department and to your local healthcare provider. They'll all have that information available. Again, as we've said for 281 days now, this is just a source of information. We try to bring you that information from the health departments, from IDPH, and from those reliable sources. And we're not going to give you anything that we don't know about. We'll refer you to the right department to get that information that you need. And that's what we're here for 281 days. And yes, as Chairman Kern said, the light is getting brighter at the tunnel, and someday you won't be looking at us, but we're committed to be here to help Team St. Clair, to help all of us get through this pandemic. And I know there's still some of you out there that says it's not the pandemic, it's just the flu, it's just a cold. And as we said now, that's what you believe, that's your opinion, you're entitled to that. But we had another death here in the county since yesterday. 295 of our county residents aren't with us, that aren't going to be able to worry about the holidays. Statewide, 15,123 deaths now. And some of you say, well, that's only 15,000 people. That's a small community sometimes.
Absolutely.
So one death is way too many. So please, St. Clair County residents and the surrounding in the region, please, Team St. Clair, we'll get through this, as we say each and every day. We need your help. Please keep sharing, spreading the word to your family, to your friends, and remember, with the holiday, Christmas coming up right around the corner, make the wise decision. As I said this week, the best gift that you can give anybody is not to give them the COVID. And you do that by watching your gatherings, wearing the mask, washing your hands, watching the social distancing, and we'll get through this. We'll be back with Daisy to translate this into our Spanish communities, and then we'll be back tomorrow for day 282. Have a good evening.
For more than 6 months, St. Clair County residents and businesses have been in the battle against COVID-19. As we see cases surging in the country and even close to home, we must again remind everyone the fight is not over. Team St. Clair has made it this far by following the guidance and direction of our public health professionals. Now is not the time to let our guard down. We must continue to wear a mask, watch our social distancing, and wash our hands. To get through this pandemic, we must work together.